Hi there, I am Tuong Phan. I'm one of the Deputy Scientific Conveners at the ANZCA ASM, and it's my pleasure today to have a brief interview and introduction to Alicia Dennis, who is a professor and has an extensive academic background, and she's also the Australasian Visitor at the scientific meeting. So, Alicia.
Hi, Tuong.
How are you?
I'm really well, thank you. Pleasure to speak to you today.
And tell us where you are. Are you at work or are you at home?
Currently, I'm at home. I've got a bit of a setup here from home, like we've all developed over the last year. Got a bit of a setup here to attend meetings and also give presentations from home as well.
Yeah. Everyone's got a little corner or room. So Alicia, yeah, it's been, I remember seeing you talk, a very impressive talk in Kuala Lumpur, which is another era, the pre-COVID era. So I am really looking forward to hearing about how your research is going and some highlights. And you're speaking at 3 sessions. So we'll see if you can give us some teasers, give the audience some teasers about what you might be talking about, but the topics themselves sound very interesting. Firstly, how do you feel about being the Australasian Visitor?
I'm pretty excited about it and feel pretty honoured to have been asked, and also to be able to do it in this era of, you know, remote learning, remote teaching, of both a virtual and an in-person conference. I think is excellent, and to be part of that in this, I suppose, new era is really exciting.
I think you're right. I think we've, you know, going into this year, we thought that the vaccine would cure all, but I think we're just having a reappraisal and realizing it's a long haul. So we've got over well over 1,600 delegates and counting, so it should be a great meeting. Okay, just getting, I think your first session is on Saturday at 11 o'clock, and it's about cardiac disease and the puerperal period. And I do know about your extensive work with preeclampsia and echocardiography. Any insights into what you'll be touching on during that session?
Yeah, well, I suppose with the 3 presentations I'm giving at the conference, there's a few common themes, and that is really to challenge us all to think outside the box a little bit, to challenge the way we think about pregnant women and the diseases of pregnancy, the way we use language, and the way we've become almost a little too subspecialised to really embrace what it means fully to be a doctor. So they're kind of some of the common themes throughout the 3 presentations. And the first one, on hypertensive disorders of pregnancy, I'm really challenging, I suppose, myself and the audience to think about the diseases of pregnancy in a very similar way to how one would think about the diseases of adults who are not pregnant. So thinking about the terminology, should we really be using the word preeclampsia? Should we really be using the word perioperative cardiomyopathy? So it's about giving a little bit of an update as to how to manage women with those conditions, but also challenging everyone to start thinking about the conditions of pregnant women in a very similar way to how we think about the diseases in non-pregnant adults. And I think that would bring, you know, pregnant women into sort of the mainstay of treatment, of thinking about the disorders, and also into the mainstream research realm.
And some of that observational data that you collected is hard to get. I remember your presentation about doing it in you know, women doing transthoracic echoes in pregnant women, a very hard patient population to study, but you had a lot of buy-in from that group. patients.
Yeah, that's right. Pregnant women that we've approached have been very keen to participate in research, particularly the women who don't have the severe disease. They're very excited, I suppose, in a way to participate. I mean, we know that, you know, most pregnant women are young, they're up to date with literature, they're quite scientifically minded in terms of their scientific literacy. They are engaged in their healthcare. So the opportunity to participate in research was quite exciting for them. And the women who were very unwell were also grateful for the opportunity to have further investigations on their heart and to be the focus of treatment and research attention rather than their unborn baby. They were very excited about anything that could help their unborn baby, but to have the focus of treatment and research on them was something they were happy to be part of and sort of almost excited about. Yeah, we were lucky with that.
Yeah, I can see that, and I suppose that comes back to another part of I suppose your professional profile, that you've advocated for gender equality and also for well, to be proactive in being in being aware of and managing health inequalities and unequal outcomes. Can you tell us a little bit about that?
Yeah, well, the more I and my team became involved in pregnancy research and the management of pregnant women, we came to form the view that pregnant women were often left out of research studies and left out of sort of mainstream thinking with regard to treatment interventions and randomized controlled trials. And then when we started to think about maternal mortality, we started to view that as really the pointy end of gender inequity. I mean, it is. These young women are dying from preventable conditions. They're dying at a premature age. This is sort of at a global level, not so much in high income countries. So we started to think that maternal mortality, the death of a young woman, is really the pointy end of gender inequality and inequity. So our work and our ideas and our writing started to really focus on that and raising the profile of gender inequity as one of the first steps in changing the outcomes, which in high income countries, the outcomes are all around morbidity reduction, but in low middle income countries, it's about maternal mortality reductions. And raising awareness is the first step in changing outcomes in the end.
Great. And I mean, it's getting, you're buying a lot into the patient-centered outcomes. Was that easy to do, to step outside the immediate anesthetic concerns, or did you follow the research where it kind of naturally led you?
I suppose there's two parts to that answer. The research has always been a path that we've followed. So each research study has led on from the previous one. Questions that arose in one study have led on to further studies. So that's how the research program has kind of developed. But then I suppose we're always having in the back of our minds what pregnant women might want to sort of, I suppose, get out of the research, or the implications for the overall health of pregnant women. And so I think, you know, some of our outcomes are related to breastfeeding or mental state and mental health after birth. So that kind of thing. And we're starting to incorporate some of those outcomes into our research, because we know that when we ask pregnant women, they're some of the really important things that are of meaning to them.
Yeah. I suppose I would observe that you're engaged in the people who you are focused on, and you've obviously listened to their health priorities. Okay, moving on to the second the session that you'll be speaking on, also on the Saturday, 3 p.m. Heal Thyself. It's a plenary session, and you are the ANZCA Australasian Visitor. Very provocative title: Doctors, Disasters, and Destiny. Which doctors are the disasters your own and whose destiny? Can you give us some teasers into where that session is heading?
Yeah, so this presentation is really about doctors finding their voice in an increasingly subspecialised sort of area, anaesthesia and its subspecialties, and also where our society and our health system is really pushing us towards rapid patient throughput and sometimes focusing on other things. So the doctors is really about us, so all of us, and some historical perspective on what it means to be a doctor based on a historical perspective. Then the disasters are really about disasters that can befall all of us at a personal level or at a family level or friend level and at a community level. And we've had lots of examples of, or a big example of that recently. And then the destiny part of it is I'm going to provide some ideas and some thinking around how we can fulfill our destiny at a core level being a doctor and how we can find our voice to make positive change in the world. I know that sounds a bit sort of grandiose, but I think, you know, at this time in the world, doctors really do play a really important part in having a voice for positive change, and anaesthetists really do have a role in that as well. We're really fantastic at focusing on patient outcome and patient safety. And what we've seen in the last year or so, that we really do have a little bit of a role in healthcare worker safety as well, because it's through being a healthy doctor that we can have healthy patients. And I think it's challenging us to take that one step back and be healthy ourselves. And sometimes disasters help us really focus on that destiny.
Yeah. Sounds fascinating. Lots of areas of interest there. And your last session is titled Perioperative Medicine in the Forgotten Populations. And, you know, the forgotten population is that you're going to talk about is the obstetric population. We already touched a little bit about that, but why do you think perioperative medicine in obstetrics is a bit forgotten? Is it the nature of the setup of the specialty in that obstetricians are procedurally focused and there's no one looking after the pregnant women in a holistic sense?
Yeah, look, it's a really interesting question. I think it comes back to gender inequity. I think pregnant women have been marginalised for a very long time. I suppose in this presentation, I'm not really going to be holding back in discussing some of these issues. I think they're really important whenever you have a marginalised population, of which, I mean, women are on one hand, and then pregnant women are even further, if you can have three hands. So I think, you know, for a long time, you know, pregnant women have been viewed as special, you know, a group that needs to be treated differently. The whole, as I talked about earlier, the whole language around pregnancy is completely marginalising. We have strange and, you know, wondrous words to describe some of these very, I won't say basic, but very fundamental medical conditions like hypertension and heart failure. And I think going along with that, people have forgotten that, you know, in our community, you know, 25 to 30% of pregnant women will have a major operation. At a global level, it's a very significant proportion of pregnant women will have a major abdominal operation. And I think, once again, heading back to the language issue, I mean, why do we call major abdominal surgery in pregnant women cesarean section? It's got a historical basis, but it also lends people to think we're talking about birth more than surgery. And whilst you know, it is good to you know, talk about birth and cesarean birth and these kind of language issues, I think once you start doing that, you take away from the fact that pregnant women are having major surgery and there's all the perioperative issues around that. There's blood loss, there's risk of DVT and pulmonary embolism. There's a, you know, a whole lot of complications that occur in the whole perioperative medicine area. until recently, has really sort of forgotten about that population and forgotten about that major surgery. So that's what that talks about.
Yeah, that's I'll be looking forward to that, and certainly even the construction of a lot of the healthcare services reflects that. So that's great. Yeah, are there any talks that you're looking forward to seeing, or you're looking forward to coming to the Engage Hub in Melbourne at the MCEC?
Look, I think I'm excited about reconnecting with people. I mean, it's been a long year for all of us, in various degrees of lockdown, either physical or emotional in many ways. So I think just, connecting with friends and colleagues and learning from the other presenters as well, will be really exciting, I think. And to just be able to sit back and assimilate, a whole variety of different lectures. I suppose I'm interested in most of them, but particularly this year I have an interest in chronic pain and some of the pain lectures, which will be really, really interesting. And so I just think for me it is about reconnecting with people, and I think that's going to be an exciting part of this conference.
Yeah, I agree. I think COVID's been a very siloed experience. Even as healthcare workers, we're still going to work, but even within the workplace, it's been by necessity fairly siloed with social distancing, masks on, and no large gatherings. So I too am looking forward to an opportunity to engage virtually, but also for us in Melbourne, the Engage Hub, for others, watch parties, and so it'd be great. Thank you very much for your time, Alicia. That's great.
Yeah, thank you very much.